Art Kellermann, our ER man.
First of all, I heard some real interesting comments made from the other side earlier, and I just want to say, y'all can't make stuff up because none of you are running for president. Second thing, Sally, you mentioned about Medicare. You know, we've had a recent experiment with private health plan efficiency. Private health plans have started administering Medicare. They're getting paid an average of 12% more per enrollee. That's nearly $1,000 more per person than traditional Medicare administers the same program. This is going to add $8.5 billion to the cost of Medicare this year in 2008, and since 2004, those plans will have sucked an extra $33 billion out of Medicare trust fund without improving the care of beneficiaries. So again, Michael, I think you're right. We got a lot of people that have gotten their hands around the federal till and have made federal government a cash cow. I think federal government needs to be a watchdog.
Let's bring the audience into it because
I want to agree with Art. I want to agree with him about
this is Michael Cannon.
about how Medicare Advantage costs the taxpayers more. I want to agree that and disagree with Sally that I don't think that we do any better in terms of health outcomes here in the United States. But those things don't get you where you think they do. The fact that private insurance companies are ripping off the taxpayers through Medicare is problematic. But the alternative is to let the doctors and the hospitals do that because they're the ones who've been doing that for the first 40 years.
I want to say one
and
other
no,
thing.
I'm not done yet. Yeah. So, and the fact that we don't lead I don't think we lead the world in terms of health outcomes, but that just means that we're doing poorly, other nations are doing poorly. No one is innovating in order to make those improvements in medical errors, except, you know, we got the Kaisers and the group healths out there that are actually doing this, and you just made an argument against having them participate in Medicare. You're trying to keep those innovations out of a government program.
Art, hold your response to that perhaps you're summing up at the 2 minutes, because we do want to go to the audience.
Isn't a dirty secret that we cannot afford to have everyone have all the health care they would possibly want? And so in America, we ration it by price, and in other countries, we ration it by lottery.
Paul Krugman, let's hear from you on that.
Yeah, no, that's definitely true. There is, although it's not clear that we're really at the point where that's the critical limitation. At this point, just eliminating health care that actually does no good at all would probably be enough to save a large amount. That's what the Congressional Budget Office says. So it's not really a, in the very long run, there is, what happens when we have the $30 million immortality treatment, that sort of thing. This becomes a big problem. I just want to break one more thing. We've been talking a lot about quality of care, but there's one other thing that is very important, which is the financial ruin that often comes from medical expenses. And that is preventable, and that's only in America. The individual who is the family that's financially ruined, even every time I look at one of the studies that says, well, we can't show that providing health insurance makes that much difference in health outcomes. First of all, I don't quite believe it, but secondly, there is a tremendous difference in terms of not the medical side, but the economic side. And this is something, again, there's a risk, a fear, a terror of medical expenses, which happens among wealthy countries only in America.
I want to point out, though, that the AARP recently released a study that showed that bankruptcy rates are rising fastest among those people who are covered by our only universal coverage program. Not only are they rising faster among that group than for other groups, but for other groups, those bankruptcy rates are falling. How is that consistent with what you said about universal coverage protecting us from financial ruin?
No, I'm not talking about bankruptcy rates. I'm talking about all kinds of
things.
And those are the elderly, right? The elderly?
Give me another measure of financial ruin.
No, come on. There are...
All right, let's go back to the audience in the middle. You may want to identify yourself.
Yes, I'm Betsy McCoy from the Hudson Institute. I'm worried about seniors and what the impact will be of a Medicare for All system on them. In countries with Medicare for All, seniors are denied treatments that seniors in the U.S. can get. The thinking is that the public health dollars are better spent on young people because the benefits will be more lasting. For example, 2 years ago, the British National Health Service decreed that seniors with wet macular degeneration could not get the drug Lucentis until they had already gone blind in one eye. Then they could get it to save the other eye. Why should seniors in the United States take that risk and support a Medicare for All system?
In Britain, there are other examples. Tarceva, the drug for lung cancer that is available here. if NICE, the National Institute for Health and Clinical Excellence, a government bureaucracy, says Torceva is not cost effective and therefore you're too old to have it, you're denied it. You can go out and pay for it in the market, but all of your services provided then under the National Health Service are no longer available to you. Is this what we want? This is what we're talking about in Congress right now with the CER, the Comparative Effectiveness Research. We want to do this in the United States. This is going to destroy the innovation that John Stossel was talking about, and is going to destroy our ability to live longer and healthier lives. It's not what the American people want.
Sally Pipes against the motion. Gentleman on the right.
There are a lot of personal stories being told tonight, and I'm glad to say that I have health insurance. And the idea of increased wait times for a medical procedure that terrifies me. But then I think about the 15% of America who have no insurance, and how long are their wait times? So basically, like, what I can't wrap my brain around is how can a system based on companies that make a profit on denying our care be made responsible for paying for our care?
John Stossel.
Well, you're right. The insurance companies have a conflict, and the insurance company has to balance. They want to pay for nothing. They hope none of you ever get sick, and if you get sick, they don't want to pay. But, of course, if they do that, word gets out, and they don't get any new customers. So that's how they have to balance that. That's how all businesses balance that. And
or they wouldn't if you were able to choose your insurance company.
That's the other problem, that you have to buy insurance here in New York from a New York insurance company. And because the politicians, always wanting to give you more, have loaded it up with all these extra guarantees. You must pay for Viagra and in vitro fertilization and acupuncture or hypnosis or pastoral counseling. I forget what's all on the list of mandates. You're not allowed to buy from Wisconsin, where insurance costs a fourth as much.
The reason you have to buy from a New York insurance company is because New York has community rating, which means that an insurance company cannot turn you down if you have a pre-existing condition. And if they throw it open across the country, then people who don't have a pre-existing condition, people who are healthy, can go shopping, and it's not some kind of crazy thing because they want people to have hypnosis. It's because they're trying to protect people who would not otherwise be able to get insurance, and that gets at the irresponsibility of the arguments that are made.
Thank you, Paul Krugman. Art Kellermann.
Yeah, there have been so many points out here that I wish we could address. One I want to talk about is waiting times, because you hear that all the time. The waiting times that matter are the waiting times for things like when you go to the ER and how quickly you see a doctor for a heart attack, how quickly you get stroke care, whether or not if you've got acute or worrisome symptoms, you can see your doctor that day or the next day, or you end up having to be in an ER. We're turning away 1 ambulance per minute in this country from overcrowded, private as well as public hospitals in the United States. If you got to limp around for 2 months on a bum knee until you get a new titanium knee, I'm sorry. That's not going to kill you. You don't get to me for 30 or 45 minutes because you've been diverted from 3 hospitals. You're going to die. That's the waiting times that we need to worry about in the United States, and it's not going to happen if we ignore this problem.
Michael Cannon against the motion.
Professor Krugman mentioned that community rating laws like you have here in New York are intended to help the sick obtain health insurance. The leading researcher in the country on insurance markets, specifically the individual market where you buy insurance directly, is a man named Mark Paul. He's at the University of Pennsylvania. And what he's found after researching what actually happens in insurance markets is he's found that those laws reduce, the community rating laws that Professor Krugman favors, reduce the number of people with health insurance, and they don't provide health insurance to many more sick people. And the reason is that that unregulated markets really do a remarkably good job of providing health insurance to people with expensive chronic conditions, provided they purchase health insurance while they're still healthy. So these regulations... Yeah. And it's expensive and difficult to do, but you cannot have an insurance market unless people do that, because no one will buy insurance until they need it. No, you can't have a homeowner's insurance market if people can buy coverage after their house burns down. That is the market's way of encouraging people to do the right thing and pay into the pool while they're still healthy.